What's up, everybody? My name is Yulitza Borges, and I am the National Fellowship Associate of Poder Latinx. I am so honored to be doing this tonight, so bear with me. This is my first time. Hello! How are you?
Hi.
We had a little situation with the internet,
Okay.
so I'm stepping in the background, but it's a pleasure to meet you. I heard so much from Nancy. How are
nice
you?
To meet you too. Good, thanks.
Oh my gosh. Well, before
I was talking and then I got a new invite.
Yeah, I'm so sorry. Well,
no, it's okay.
We're gonna go ahead and just like reiterate. So, again, my name is Yulitza Borges. I'm the National Fellowship Associate. And, thank you all for joining tonight. Thank you so much, Marina. You are amazing for doing this. So, a little bit about the fellowship is that we are a part of a cohort with 14 poderosas in about 7 different states. And our mission is just to build a political wave for Latinx or decision makers in our political process and play a vital role in the transformation of our country. Our work includes issue-based organizing, leadership, development, expanding the electorate, and a year-round civic engagement. Thank you all for joining tonight at Poder de Tu Salud. Before we begin with a couple of questions, I would like to hand off to the floor to our distinguishable guest, Dr. Maldonado Stitt. Tell us a little bit about yourself, about your story. Who are you? What do you do? And again, once more, thank you for joining tonight. The floor is all yours.
Awesome. Yeah, so my name is Yasmin Maldonado. I was born in Guatemala, but I moved to the United States when I was really young with my parents. They were both doctors and they did their training here in the States. And growing up, I never even considered being anything other than a doctor. I did most of my training in Houston, Texas, really all of my training in Houston, Texas. So my medical school, my residency, and my fellowship. And it was a really great place to train, especially as a Spanish speaker, native Spanish speaker, because about 90% of my patients, probably not quite that much, but like 70 to 80% of my patients at the county hospital were Spanish only. And so it was a really great way to make a difference in their lives, because there's nothing like being able to communicate with your doctor in your native language. And the other great thing about training in Houston was that I saw a lot of lupus. And so I'm very comfortable with that disease. I've seen it in all sorts of different ethnicities, but also I've seen really mild lupus and really severe sick patients in the hospital. And so it's a really interesting disease with a lot of different presentations and complications. And I feel really lucky to have been able to train there. Additionally, Houston is a huge health center. It's the biggest medical center in the world. And so we see a lot of lupus patients. We have a large Black and Latinx community, and lupus is relatively common in those populations. And so we see both a lot of lupus, but also really severe lupus, because we also worked at one of the level 1 hospitals there. And so we would get transfers from, several states around us. And so I definitely saw a lot of lupus, which was really great to be able to be comfortable with those patients.
That's amazing. I'm happy to hear that, not a lot of doctors build that relationship with their patients, but it's just so incredible seeing that there are many doctors like you out there willing to do that. Before we get started, I just wanted to say that you got, for the viewing audience, you're allowed to ask any questions. Just comment down below and I will make sure to see the questions. But we'll start with our questions, our Q&A. The first question is, Black and Latina women are 2 to 3 times more likely than white women to develop lupus and have more severe disease progression. In your respective opinion, why do you think it's harder for BIPOC, Black, Indigenous, and people of color women to have a clear diagnosis of lupus?
So you're definitely right. Lupus is a disease of women. And so men do get lupus, but they tend to not get it as often and not as severe. And it also is much more common in Black and Latinx women. And so white women and Asian women still can get lupus and still can get severe lupus. But in general, Black and Latinx women tend to get lupus much more often, and also tend to get the more severe spectrum of disease that we see. One of the biggest hurdles in getting a good diagnosis is really having your doctor listen to you. And in general, women have a harder time having their doctor sometimes take their symptoms seriously because it's very easy to say things might be related to anxiety or depression. And this is difficult enough in white women, but it really is probably compounded in Black and Latinx women.
Thank you so much for your expert insight. Our next question is, Latinas are more likely to lack health coverage among America's uninsured women, with more than 38% being uninsured. In your profession, what is a resource we can provide the Latinx community to be aware that lupus is essential as any other checkup?
Mm-hmm. And so, it's important to note that, yes, lupus is always a possibility in anybody, but we also don't want patients to be scared that they might get lupus just because they're Black or just because they're Hispanic. And so I don't routinely recommend getting those really in-depth labs for everybody, because a lot of people will have those be positive and not be a meaningful positive, meaning that they, the ANA test that is needed to diagnose lupus can be positive in about 20% of normal people. And so really the most important thing is getting routine labs. And so things like your CBC and your BMP, which looks at your white cells and your hemoglobin, your blood levels, and looks at your liver and kidney function, making sure that things like that are normal. Because if those kind of labs become abnormal, your doctor really needs to look for a reason as to why those are abnormal. A young 20-year-old woman should not have really low white cells and should not have abnormal liver or kidney function, and they should not be anemic. And so if things like that pop up, it's important to look into them. And the other thing that we need to do is really women need to be aware of their own bodies, because you are your own biggest advocate. You know what is not normal for you. And so if you have symptoms that you feel are not normal for you, you need to talk to your doctor and get them to listen to you, to investigate further, because you obviously know yourself better. And beyond that, if you find a doctor who is not listening to you, it is absolutely your right to go to a different doctor until you find someone who will listen to you and who you are comfortable with. Regarding insurance, it becomes very difficult, but there are, in a lot of bigger cities and states, programs to help with the indigent population and to get cheaper health care. If you are near a teaching institution, so somewhere where they have residencies and fellowships, oftentimes you can get care for less than you might be able to at a private clinic.
Wow, that was so insightful. Thank you for that. And moving on to the conversation with like a pandemic in mind, in the midst of this pandemic, COVID-19 is known to attack the immune system. I was wondering, how does this impact lupus patients? Because just by Google definition, I know that lupus is, it attacks its own immune system, right? If you can give us a little insight on lupus and how COVID ties in on that.
Yeah, so the immune system is a complicated beast. And even as a doctor of the immune system, it's still, it's so wide in its breadth. And lupus and any autoimmune disease is basically your body, instead of attacking your cells and bad things, so like bacteria and viruses, it gets confused and starts attacking yourself. And in lupus, certainly when people have very active disease, it can really suppress the immune system. So the biggest part of trying to keep patients safe is to have your lupus be well controlled. Because if your lupus is well controlled and you are not actively flaring, your disease is, your kidneys are good, everything is good, your white cells all look normal, then your risk of getting COVID is not much higher, if at all, than the general population. If your lupus is very active because you are not on, not taking your medications, or you're not on the right medications, then you're much more vulnerable to COVID. That being said, even if your lupus is not active, and so you're not at a higher risk to get lupus, you might be at a higher risk to get more severe disease if you do get it, even if your lupus is well controlled. So a big part of this is going to be getting patients vaccinated, and making sure that they are as protected as they can be. with that, you need to definitely talk to your doctor, because some of the medications that people might be on for lupus can interfere with how well the vaccine works. And so the most common medication for lupus is Plaquenil. That one does not, which is great. But there are all sorts of other different medications that do decrease how effective the COVID vaccine and other vaccines might be.
Amazing. Sorry about that. I'm still getting used to the live, but thank you so much for that response. We have a question here. It says from Jolie, Cup of Jolie. Hello. Thank you so much for joining. They asked, I'm sorry, what are some holistic suggestions you would say would be worth looking into? And how can we contact you or your practice for questions or consultations?
You know, in terms of holistic things, eating a healthy diet and trying to maintain a healthy weight for you are really going to be the biggest things. Beyond that, sometimes there's some supplements like turmeric that in studies have been shown to help decrease inflammation. And that is probably the most helpful when people have arthritis, so joint pain. It probably won't do as much for some of the other symptoms of lupus, but really a big thing is avoiding things that might trigger you. And it's really going to be different for every patient. Some patients, I have had some patients with things like arthritis, and they say they eat eggs and they feel really bad when they eat eggs. And so for those patients, I tell them avoid eggs. But there's no blanket statement to be able to tell people. The only diet in studies that has shown to decrease inflammation is the Mediterranean diet. And it's just a really healthy diet with a lot of vegetables, a lot of fish, not as much red meat, olive oils instead of things like butter or lard. And so just a much healthier diet really helps control inflammation a little bit more. In terms of consultations, I really can only legally, because of malpractice reasons, can only see patients in Oregon. And so that does kind of make it a little bit more difficult.
Well, thank you so much for that. And just one last question before we just bring it down is, with the vaccination being available now, what do you recommend people who have lupus to do before getting the vaccine?
So in general, I say get any vaccination that you can. So whatever is available to you. But for lupus patients, my recommendation is just a little bit different, because lupus patients inherently have a higher risk of blood clots. And so I would say maybe try to avoid the J&J if you can, because it does have an increased risk of blood clots. That being said, if that's the only one you are able to get, the risk is not super high. And I would rather have a patient get that vaccine than not have a vaccine. And like I said before, always talk with your doctor before you get the vaccination, so that depending on what medications you are, they might tell you that you need to hold it. So not take it for a couple of weeks, either before or after the vaccine, just so that we make sure that it works as well as you can. So it's always just important to coordinate with your doctor.
Amazing. Thank you so much for your expertise, Dr. Maldonado. Before we wrap up, thank you so much for joining and being our guest tonight. It's such an honor to meet you, not just as a madrina, but, coming out here and giving us resources and just information so we can become more educated. Is there anything you would like to say to the viewing audience before we go?
I think being an advocate for yourself is really the best thing, and finding a doctor that isn't, sorry, that was my dog, that is an advocate for you as well. And so you need to find a doctor that you feel comfortable with and that you feel is fighting for you as much as you are fighting for yourself. And, don't be afraid to ask questions, and just really try to be as much of an advocate for yourself as you can, because no one else can do it as good as you.
Facts. I love that. Be an advocate for yourself. Ask questions. Do not be afraid to ask questions. You guys heard it from Dr. Maldonado Stitt tonight. And we would just like to thank the viewing audience for tonight's program. We hope that you continue to join us for our future events. This is not the last one. We will have more doctors joining us, and there's some events in Spanish. Hay algunos eventos en español. So please check those out. Check off our page. You can text Poder, Poder, at 52886. Also, make sure you find your vaccine site and protect our vulnerable populations and yourself. You can check out our website for vaccine sources at poderlatinx.org. Thank you all for joining tonight. We hope you have an amazing evening. And thank you so much again, Dr. Maldonado. You are mostly the best awesome person that can do this last minute. Thank you for keeping up with me. I know that the internet is horrendous, but thank you so much. And thank you all. Just one more, text Poder at 52886, Poder, Poder. So bye y'all.
Yeah.